So when we think about marketing objectives, they're no different to any other objectives, where it's good to think about objectives that are SMART objectives, so specific, measurable, achievable, realistic, and timely. So I don't suggest, spending too much time on marketing objectives, just a couple of key ones, just so you can have a rough idea whether things are changing, whether things are heading in the right direction. And, to that, I guess the number one objective when I think about marketing objectives for a health practitioner is, are new patient appointments increasing? That is the biggest, by far, indicator whether marketing activities are working and whether your practice and business is growing and heading in the right direction. What is also helpful is if you do really focus on one specific type of service or treatment, to also have a look at how many of those you're delivering on a monthly basis. And think about, what you want those numbers to look like in the next 12 months. Whether it's very difficult because it's to pick a number, whether it's, and I don't want to suggest a number because there's lots of factors that influence it, which I will talk about. So things like brand management comes into play. So, we spoke earlier about brand associations. So that can impact your business or your practice growth, because let's say you have someone looking after inquiries for you and, they're just really rude to people, then, you'll have less patients coming in because of that. Different type of marketing activities and advertising spend, inquiry conversion is really important. There's obviously no point in investing in marketing and your prospective patient inquiries are going up, but you're not turning those inquiries into new appointments. And that can be because of a number of reasons. It might be that you just need to tweak something in terms of responding to that inquiry, in terms of a time frame and messaging, or maybe the people inquiring just aren't the right patients for you. So maybe it's an issue with messaging or the marketing channel that you're in. Diary management plays a role. I have worked with some doctors whose practice managers were amazing at managing their diaries. So they, if there was a new patient coming in, they just worked magic to pop that patient into the diary, because, the sooner you can pop a new patient into your diary, the less chance that patient will go see a different health practitioner. Because these days you can be sure that, prospective patients are looking at a lot of different health practitioner options. Even if their GP has referred them to a particular health practitioner, they will be sussing you out and other people out through their websites and social media. And they will be sending inquiries as well. So they will be sending emails off or calling different practitioners to suss out appointment fees and waiting times. So capturing that initial inquiry is really important and can make a big difference. Obviously, changes in your personal work life. If next month you're off traveling around the world, going to lots of conferences, your patient new appointments will obviously be down a month. So what I really say is, don't get too fixed on month-to-month numbers. If there's a general trend in the right direction, so over the next 12 months, as your patient numbers are going up, if your new patient appointments are going up, then that's good. And I wouldn't get too worried about numbers in a shorter time frame.